Okay, hello everyone. Today we're going to be talking about applications of epidemiology in public health. So as a guest today we have Silvia Gonzalez. Silvia Gonzalez is a PhD candidate, pursuing her PhD degree at the Children's Hospital of Eastern Ontario currently. But she's due to COVID, she's back to her country in Colombia. So hi, Silvia.
Hello, I'm very happy to be in your course today. Thanks for the invitation.
Yeah, thank you. So do you want to introduce yourself to the class in any way that you like?
Okay, I'm pretty bad to talk about myself. I don't like it that much, but yes, for sure I can do it. First of all, sorry for my maybe my bad English. I've been here for almost 10 months and I am not practicing my English that much. So I apologize for that in advance, sorry, for example. But okay, so as you mentioned, I'm a PhD candidate right now. I'm a nutritionist. It was my degree from the National University here in Colombia. After that, I did a master's in public health, and that's when I started working in physical activity, and it was my first approach to research. And after that, I didn't stop. I started working in research and doing my master's at the same time. And it was a great experience. Then it took me to the epidemiology path. I was working for the group of epidemiology in Universidad de los Andes. It's one of the top universities here in Colombia. And then I decided to do a PhD. I wanted to continue working in public health, and the best fit for me to continue doing my research in physical activity and other lifestyle topics was the program in epidemiology at the University of Ottawa under the supervision of Mark Tremblay. So that's not exactly who I am, but part of what am I doing and the topic related to the conversation today.
Right, thank you. That was a great introduction. We cannot definitely define you as just one academic or one researcher. You're a good friend of mine and you're a really nice person. So I really appreciate that you're joining us to talk about public health and the application of epidemiology in public health. So thanks for coming in, and don't worry about English. I wish we can speak Spanish and we can do this interview in Spanish, but unfortunately, the only two words that I know is hola and amigo. So, hola,
those are
amigo,
important ones.
right? And gracias. So, yeah. So, yeah, thanks for coming in and for the nice introduction. So today we're going to be talking about, the use of epidemiology in forming public health policy or to the promotion of public health policy. So, or public health, sorry. So I think you are situated perfectly to talk about this topic. So you gave us a little bit of a background of your research training, but what are you interested in terms of your research efforts?
Okay, my main topics of research are physical activity and obesity related variables mainly in children and Latino populations.
Mm-hmm.
I'm very interested also in all the influence of the built environment, public policy. I have a lot of different interests, and at different stages of my studies I've been able to go deeper in those.
Mm-hmm.
So right now I'm focused on physical activity in children and their main correlates. Specifically in active transportation is one of the topics that I've worked the most.
Mm-hmm.
But I have also, I'm also interested in nutrition variables. I just hadn't have the opportunity to work much on that as I would like as a nutritionist.
Mm-hmm.
I've been working more in physical activity, but I feel like I'm going back to those interests right now and maybe for the future for a postdoc or future work.
Yeah.
I think it's a very relevant topic right now here in Latin America. Childhood obesity is just starting to be a problem while we still have undernutrition. So I think there is a lot to do in that regard here.
Mm-hmm.
Also, I love the like the particular contexts that we have here in Latin America for research and how the environments provide very unique laboratories for studying health. So the urban context is a very interesting topic for research, like all the urban health related outcomes. That's something where there's a lot to do.
Nice. So I think you brought up a couple really interesting topics. So the first one is the built environment. And you mentioned that you're interested in active transportation, especially out of the physical activity spectrum that we look at. So what do you mean by the built environment?
Okay, it's basically the characteristics of the cities and surroundings, mainly in the urban context. Because if we talk about rural context, the most relevant thing is the natural environment. I will say the built environment is that environment that has been modified by the humans. So in the field of physical activity and active transportation, there are certain variables from the environment that are very relevant, like the density of the cities, the distribution of, I don't know, for example, bus stops, these kind of things that we may not think that are very related to the health of people. They are, and it's very interesting to see how they can be related in opposite ways according to the context. If you see the research in built environment and physical activity in the US and Europe, their results are completely different from what we have here in Latin America or maybe in other low and middle income countries' contexts. So that's something that I also find very interesting, because sometimes we kind of replicate those things that work in the north and they don't work the same here. The concepts, the actions, the infrastructure, they don't work, not always work the same. Yeah.
Right. But because I guess research production is mainly originated from Western countries, I guess it's like we are taking the information from the evidence developed by, Western wealthy countries and try to apply that into different contexts in different countries. But I guess it doesn't really work.
Yeah, exactly.
So can you tell me a little bit about the context of Colombia? So what kind of policies for active transportation, for example, have been successful, and what kind of policies haven't really been?
Well, active transportation here in Colombia is something that occurs mainly by necessity. It's not that we can say that we have the better infrastructure or the best policies. No, it's just that just 20% or 25% of people here in the capital, in Bogota, have a car. So the rest of the people have to use the public transportation that is chaotic,
Right.
or have to walk or use the bicycle. So
Right.
it's mainly a necessity.
Mm-hmm.
But there are also interesting policies. We have a bike law, something like that. It's called the Obesity. It's like bike-friendly law, law. And it's very interesting because it encourages the. It starts with the people working for the government at the national and local levels. And if they go biking, if they bike to work, let's say for the whole month, the 30 days of the month, they have like half free day paid, like half day that they don't have to work or something like that. It's like an incentive for them to go bike to work.
Right. Nice. So it's a very good reward.
Yeah. Yeah, it can be a good reward.
Yeah, you get a day off and you get paid.
Yeah.
Nice.
And also there are other incentives like public transportation cards. They are also within the actions of this law, they are improving the infrastructure in the public offices, buildings to have parking, showers, or this kind of infrastructure that will promote the use of active modes of transportation. And that also applies for people who are walking to work, not only bike, but also walking. So that's great. It was put in place like in 2015, so the impact has not been evaluated yet. But at least in the last survey of nutrition, where we evaluated the engagement in biking for transportation, we found that at least it's not decreasing, and it has increased a little bit among women, which is great.
Oh, that's awesome.
Yeah.
Nice.
So it's slow, but there are like many things that need to happen at the same time. Right now with the COVID pandemic, people are avoiding public transportation, so they are biking more, and it's incredible to see how they are taking lanes in main streets just for bikes.
Oh, nice.
Which was impossible in the past, because even if it's just 25% of people with cars, they have a lot of influence in these kind of decisions, and it's difficult to take space for the bikes in the roads here. But right now it's happening, and it's great.
Right. So yeah, like you said, 25% owning their own vehicle. That's pretty striking compared to, Canada, and we probably, probably over 90% of the population own a vehicle here. And yeah, so that's pretty interesting. And like you said, those 25% who own a vehicle, they're probably more likely in a position of power to make policies. So it's great that the changes are happening due to the pandemic, even though the pandemic has more negative things than positive things. Yeah. But I think that's good. So that leads to my curiosity about what's going on in Colombia with COVID-19. So can you tell me a little bit about that, and in terms of public health restrictions or regulations, how things are going there?
Yeah, well, it is difficult here because The government doesn't have a lot of help for people, so it's not easy to make the choice to stay at home. So during the first, let's say, 8 months, it was very under control. But then people realized that government were not going to help a lot, and that they needed to work and needed to do things.
Right.
So the main cities and the whole country opened a little bit, and slowly all the measures, all the lockdown was relaxing, and the cases were increasing until it got out of control during the holidays. Here, of course, the economy was pretty bad even before the pandemic, and during the holidays, the how do you say that? Like the commerce didn't close. Like people were encouraged to go shopping and all of those things to not to affect the economy, which was pretty bad, and we are seeing that right now with more than 20,000 cases per day during the last weeks. So it's getting pretty bad, and now we're going back to the initial measures, but in let's say we are not in a general lockdown. It's more by neighborhoods or localities where they have the highest amount of cases. It's like escalated. I don't know if that word exists.
Yeah. Oh, yeah, it does.
Is in order to avoid closing the whole businesses and the whole the whole cities and services. So the government is trying to combine the actions in certain places, and they can only do that in cities where they have ICU occupation higher than 70%, or sorry, higher than 50%. In the rest of the cities, they should be like having social
distancing.
Yeah, distancing.
Yeah, or physical distancing. Yeah.
Also, they implemented all these protocols that we are not sure that are very useful at the end, like putting these cleaning stations at the entrance of the shops, measuring the temperature, but the equipments, they are not the best, so they are not very accurate measures.
And what about the vaccine situation there?
They haven't started. They have looks like a good vaccination plan, but I think it's the same as in many other countries, that we don't know much about the negotiation that the government did with the laboratories. So they don't have a certain date for to start the vaccinations here. Everyone are very optimistic about that, but it will be slow. It will be very slow. Here in Latin America, I think just Argentina, Mexico, and Costa Rica have started and have done good progress with the vaccines. Right now there is a lot of tension about that topic here.
Right. Okay. Yeah, that's really good to know. So I want to go back to the research topic that we were talking about. So we were talking about the built environment and how, good built environment can encourage people to commute in an active form versus passive form. And now your research exhibit, it's called Open Streets, a healthy epidemic. So can you tell us a little bit about what this is about and how it is going, how it has been implemented in Colombia?
Yeah, okay, that fact sheet, I think is called.
Mm-hmm.
It's a little bit old. I think it's
Mm-hmm.
from 2003 and I don't know, 13, 15.
Mm-hmm.
I don't know.
2013, I think.
Yeah, but we have kept updating that, like the research in that topic. Open Streets, for those that don't know, is a program that closes streets for two vehicles and open them for running, biking, jogging, walking,
Mm-hmm.
all kind of physical activities usually during Sundays and holidays.
Mm.
And it depends, like it vary. It's different according to the context, right? It
Mm-hmm.
started in the US, actually.
Mm-hmm.
Some people
Mm-hmm.
think that it started here in Colombia, in Bogota, but
Mm-hmm.
no. It was inspired by something they did in the Central Park.
Mm-hmm.
But then some young people from Colombia went there and they loved the idea and they brought it here and they started closing the main streets in Bogota. And it's a great initiative. I love that program because it's something that has been replicated in many countries.
Mm-hmm.
And it looks like a physical activity or recreation program, but at the same time is a public health program because it creates opportunities for healthy lifestyles. In many places, like here in Bogota, you see that, yeah, people go out to exercise, but they also have healthy food along the paths. And
Mm-hmm.
we have studied the different outcomes regarding to the implementation of these programs, and is in terms of air pollution, noise,
Mm-hmm.
well, physical activity, mental health outcomes. It has a lot of benefits.
Mm-hmm.
So that's one of the programs that we liked the most to study
Mm-hmm.
here in public health, and it's an amazing example of how do you call it? Intersectoral efforts
Mm-hmm.
for health. So here
Mm-hmm.
you can see how, at least in the case of the program in Bogota, you can see people from the sports department or ministry working in this,
Mm-hmm.
but also the health department, urban planning, the police, the education, because for example, students in the last year of school, they
Mm-hmm.
volunteer for the program. So there is a nice integration of
Mm.
many different actors in creating these opportunities for people to be active.
Mm-hmm. Nice. So intersectorial work, I think that's an important point and very essential element for successful public health. So I guess it's just not about epidemiological evidence that we produce as a researcher, but working together with people who, who wants to better people's lives and their health.
Yeah, and you see that there are many wheels, like
Mm-hmm.
people wanting to work on this, but
Mm,
sometimes they don't know how to advocate for these kind
right.
of programs. And that's where I think that we as epidemiologists have a great opportunity to contribute. And that's what we have seen here with the group that I work here in Colombia. We have been
Mm-hmm.
very close to the leaders of this kind of programs in the country. So what we have done is helping them to choose, okay, what can we focus in? What benefits do you want to study about this program? And how can we present this to policymakers to help them to make good decisions and to keep these kind of programs in place? So right now, like, it started in Bogota, but it's in more than 60 municipalities here in Colombia. It's a permanent program. And it has been the same in the world. It has replicated with different motivations, I think, in different contexts. But there are many people from our field working in this, and it's amazing to see how, like, all the benefits that you can find. And also it's challenging for us because we are public health people. We know the importance of making people more active or these kind of things. But when you have to convince a policymaker who has the money or who decides on the budget for a city, you need to talk in terms that they will understand and that will make them interested in what you are doing. So, for example, in that fact sheet, you can see that there is cost benefit analysis, I think. Yeah, where you can put the benefits of ciclovías or open streets in terms of money, how much they can save in health expenses having this kind of programs, for example. So yeah, that's something that I think is great for people who work in our field, to see how they can have an actual impact on the policy making and decision making of local or national contexts.
So it's truly a collaborational work. But before we get to the collaborative work process stage, I guess we, as a researcher also, and public health, those who are involved in public health, we need to sell the program to those in power that this is worth it. We're gonna save money by doing this. So I guess that it's not an easy job to do.
Yeah, no, it's one of the main challenges. And yeah, like, the knowledge translation is super difficult sometimes. And we have seen that with COVID. It's very difficult that people don't interpret the data in a different way, and it's super, like, it requires some training, and it's not as easy, but I think we need to do that if we want to have an impact.
Right. So I guess as an epidemiologist, like, we produce numbers, we produce statistics, so, and economists too. So conducting this type of cost benefit analysis and providing important statistics to public health authorities and those who are in power, I guess that's really important as well.
Yeah, absolutely. And the thing that I think we add, it's not like, economists, that they can put everything into numbers. And we also know what are the relevant variables for whatever outcome we are studying, right? Sometimes, and I've seen that working in these interdisciplinary teams, where you have people who are great with the statistical models and they have great ideas on how to do an analysis, but they also need our inputs to choose what variables to take into account in one of the in the models.
Right.
So that's great to see how we can complement very nicely in these kind of teams.
Nice. That's great. So I think we talked about important things about applying epidemiology to develop public health policy. But one thing that I will also want to discuss is what happens after. So we develop this epidemiological evidence, we work with people, we build partnerships with, urban planners and the cities, and different people working in different sectors. And we develop public health policy that could work really well. But now, and as you said, open streets, it hasn't been evaluated. So what requires for epidemiologists to evaluate public health policy?
Sorry, I'm not sure if I understand what you're asking. Like, what do we need to follow up with this effort or something like that?
Yeah, so as an epidemiologist, how can you follow up to evaluate these type of public health policy to see if it's successful or not? So I guess your research paper could be one example, kind of monitoring the levels and the trends of active transport and the use of open streets. So can you tell us a little bit about that?
Yeah, I think what I've seen is a big effort from the researchers to continue studying these kind of initiatives.
Mm-hmm.
But it would be great if it would come from the institutions or the governments who are implementing these programs, because usually we as researchers try to get a grant to study something like that and then to help to maintain the programs or not, but it should be also an interest of the the governments who are implementing this to continue them. This is a very interesting example, the Open Streets programs, because it has not been attached to any particular administration. So even if the mayor changes, the program is still in place. They will never touch it. Also because there is a lot of community engagement. So the community wouldn't allow the program to end, right? They will always advocate for the program, but that doesn't happen with all the programs that you see in public health.
Right.
You see that many of them depend on the political will, on the administrations or the people who bring the program, and then they change the administration and the program is over, which is is very bad. And sometimes you just don't get to evaluate the program because they finish it before. So I think that it will be great if we could convince the policymakers just to ensure that they could have a follow-up or an evaluation of whatever interventions or actions they are doing.
Right.
Yeah, so but right now I think it's sorry?
No, go ahead. Right now.
Oh yeah, it's something that needs a lot of action. Like, we as researchers need to advocate for that, like monitoring and evaluation of initiatives. Also, we have seen that it's very useful to engage the community. I have had the opportunity to work with citizen science in some of these projects, and oh my God, it's incredible to see all the power that they have. So I think that's something that we can explore, and that I will invite your students to look at, because it's engaging people as part of the research process and asking their own research questions, collecting the data, looking for solutions, like engaging them in all the process, and that that can have very interesting results. Yeah.
Right. So I guess for public health policy to be successful and to continue being successful, I guess government engagement and continued investment are key to success, basically.
Yeah.
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 Nice. Yeah. Well, that's really good thing to know. So lastly, do you have anything to say to our students? Anything that you want to convey? And you can speak in Spanish. So go ahead.
Well, this is the moment for the advice that you said.
Mm-hmm. Yes.
Okay. Yeah. I think that my advice will be to try and find, when you're deciding on what do you want to do, try to find something that you feel passionate about, or that you can combine with something that you're passionate about.
Mm-hmm.
So it will make easier to deal when things are not that easy. That is
Right.
most of the time, depending on
Yeah.
what you're doing.
Mm-hmm.
Yeah, but that's key, I think, to enjoy whatever you're doing.
Mm-hmm.
If you like epidemiology, that would be great. And these kind of programs are, yeah, I think there are many nice outcomes that can be studied, and it's great when you find something that you really like to do, because you don't mind about having to do a lot of that.
Right.
And I don't.
Having to
Sorry?
go through difficulties like convincing government officials.
Yeah.
Yeah.
Yeah. And I don't know what to say in Spanish.
Well,
Buena suerte. Buena suerte a todos con el curso. Good luck to everyone with this difficult course.
Nice.
No.
Okay, well, thanks, Silvia, for coming in today, and it was great to talk with you. Thank you.
Okay, thank you. It was a pleasure.